Before using the FRX, confirm that the patient is in cardiac arrest by establishing that the patient is unresponsive and is not breathing normally. Assess responsiveness. If the patient is unresponsive, immediately call 911 or the emergency medical services number for your area. If another person is available, ask him or her to make the call and bring the defibrillator. Open the airway and check for breathing. If the patient is not breathing normally, give 2 rescue breaths. Usually, a person in sudden cardiac arrest is not breathing at all, but sometimes abnormal, ragged breaths occur for a short time after collapse. If the FRX is not immediately available, perform CPR until someone can bring it to you. Once the FRX arrives, quickly apply it to the patient. Using the FRX is very easy. Place the FRX carry case on the same side of the patient that you are on, near the patient's head. Open the case. Press the green on-off button to turn on the defibrillator. The FRX will start giving you clear, calm instructions for using it.
Remove clothes from patient's chest.
As instructed by the FRX, remove the clothing from the patient's chest. Tear or cut it off if necessary.
When patient's chest is bare, open gray plastic case and peel off white adhesive pads.
Then remove the gray plastic pads case and open it.
Attach pads to bare skin exactly as shown.
Next, place the pads.
Look carefully at the pictures on the white adhesive pads. Peel 1 white pad from the gray case.
Peel 1 adhesive pad from the plastic case and place it on the patient's bare chest, following the illustration on the pad.
Place pad exactly as shown.
It does not matter which pad is placed first. The FRX times its instructions to match your pace. It will remind you to place each pad on the patient as shown in the illustration.
When the first pad is in place, peel the second pad. Place pad exactly as shown.
Then peel the second pad from the plastic case and place it.
Press pads firmly to patient's bare skin.
As soon as the pads are attached, the HeartStart FRX automatically begins analyzing the patient's heart rhythm.
Stay clear of patient. Analyzing heart rhythm.
Rescuers should not touch the patient while the defibrillator is analyzing. The caution light will turn on and start flashing as a reminder that no one should be touching the patient. If a shock is advised, the caution light will stop flashing and remain on, and the orange shock button will start flashing.
Shock advised. Stay clear of patient. Press the flashing orange button now.
Before pressing the button to deliver the shock, you must make certain that no one is touching the patient. Press the orange shock button to deliver the shock. For safety reasons, the shock will not be delivered until you press the button. After delivering the shock, the FRX immediately tells you to begin CPR and provides a CPR interval. During the first 30 seconds of the interval, you can press the flashing blue I button and the FRX will provide CPR coaching.
Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
Provide CPR until the patient begins breathing or moving, or the FRX tells you to stop CPR or to stay clear of the patient. Leave the pads attached to the patient and the FRX turned on in case additional shocks are needed. In all cases, continue to follow the defibrillator's instructions until the emergency team arrives.